Hello, everyone. This is Shad Reish from CVI 2025. I'm really privileged to be with Dr. Nicholas Amoroso to talk about aortic regurgitation and transcatheter therapy for this disease state. Nick, thanks for being with us.
Yeah, thanks for having me.
Last year we had a presentation, was the highlight. It's about a new paper and publication about the AI, or aortic regurgitation, AR. So tell us what's new now and where we are with the new iteration devices.
Yeah, we're excited that new data is coming out about treatment of aortic regurgitation with dedicated transcatheter valve replacement devices. The Align AR trial has just recently discussed its 2-year results, and we're also seeing more data coming out about other devices as well who are earlier in their experience. What's been pretty consistent is that there's an option for safe treatment of patients with aortic regurgitation without classic calcific disease that we've been treating with aortic stenosis.
Great. So when you say new data, this is more follow-up study or more analysis done from the previous trial. Did you focus about like adverse outcome or durability of the valve?
Yeah, so the durability of the valve has been excellent, as we've come to expect from TAVR devices. The safety of these devices has continued to be positive. And we're excited to learn more about aortic regurgitation patients, because it does seem that they are a little bit different risks for pacemaker than the techniques and risk factors we saw with aortic stenosis.
Yeah, and just for the audience, is these devices are balloon expandable or self-expandable? And in terms of imaging you use during deployment?
Two valves that have been the furthest along in their investigation are Yena valve and J valve, and both are self-expandable devices. And they have unique elements that help clip on or stabilize involving the valve leaflets. So seeing these self-expanding devices, but learning some slightly different techniques for deployment has been a helpful learning curve.
And then when you mentioned about some different complication rate or pacemaker needs, is it like higher than self-expanding for aortic stenosis or lower or the same?
It is higher than what we've seen for aortic stenosis patients. And part of that also seems to correlate with things like annulus size and the patient's ventricle. So there's certainly patient risk factors that are specific to the disease process,
Right.
not only the type of valve that's being put in.
And it makes sense because you need more anchoring, so more pressure, more Hirschsprung kind of compromise.
Yeah, and even with these being pretty soft, relatively speaking, soft, self-expanding valves with depth protection, right? Most of the locators, for example, on the Yena valve prevents it from being too deep in the ventricle. We still see that there's a higher pacemaker risk than we've been accustomed to with aortic stenosis. So there's more to consider now.
So do you think transcatheter valves going forward, we're going to continue to have new iteration and devices to help us with this cohort of patients?
It would be really exciting to have a commercially available valve here in the United States to treat aortic regurgitation. This patient population is very frequently higher surgical risk, and having that opportunity would be very important. No doubt that as the engineering continues to improve, then we'll continue to see more and more adoption of this treatment for aortic regurgitation.
Absolutely. Well, Nick, thank you again for updating us about aortic regurgitation therapy using transcatheter options. This is Shad Reish coming to you from Austin and CVI 2025.